right. Hi, everybody. And we're going to be starting in a few minutes, so just kind of hang tight, get yourself a drink. I hope everybody is having a good week. All right, let's get started. Hi, everyone. Thank you again for taking the time out of your busy schedule to join me in Friday's weekly wrap-up. So this week, it has been busy. So let's get started. First, I want to talk about the shooting of Jacob Blank. Jacob Blank remains hospitalized after sustaining multiple injuries and is handcuffed he was handcuffed to his bed. Because, hey, a person that has been shot 7 times and is paralyzed, why not handcuff him? But, of course, that makes no sense. He poses no threat, and even Wisconsin Governor Tony Evers stated he couldn't imagine why Mr. Blake was handcuffed. So to be fair, there was a statement from the police chief. It was an outside law enforcement agency that had him handcuffed. And there was some type of warrant on Mr. Blank. But I heard tonight on Jerry Reed, according to his father, they were only misdemeanors. So I've heard different comments on both sides. He shouldn't have ran. He shouldn't have been near a knife or whatever. But when it all boils down to it, he shouldn't have been shot 7 times in the back in front of his kids. Most of you know I am a prior correction officer. I have had law enforcement training. And in my opinion, there are 3 types of police officers, and I equate this with, to my observation with correction officers. So the first is the honest, hardworking police officer that is there to try to protect and serve the community and generally cares about everyone. You have the second one. I wouldn't call them racist, but they are implicitly biased towards minorities. But in matters of criminal justice, implicit bias can have life-altering implications. And finally, you have, number 3, you have your racists who should never, ever have the honor of wearing a badge. I don't know about you, but, I am tired. I am tired of hearing about another black, brown, and an indigenous unarmed man life taken by the hands of police. I am tired of explaining and defending Black Lives Matter. Yes, every life has the same value, but African Americans and black and brown people, we are trying to make our lives, bring light to everybody that our lives matter too. We're not asking for more, we're asking for equal, the same. We have a long way to go if we're all going to be treated equally. But this is going to take effort from everyone. This administration continues to spew hate and division, and more retraining of police officers is not going to fix the problem. This is coming from Gus Rockets, by the way. So the House did pass a bill in which I definitely support back in July, the George Floyd Policing Act, that would address a range of policies and issues regarding policing practices. It includes measures to increase accountability for law enforcement misconduct and to eliminate discriminatory policing practices. This bill will never become law unless we start cleaning house, starting at the White House. So, What are your thoughts about the shooting of Jacob Black? Anybody has any thoughts or comments? You can enter the information in the comment section. No comments? Okay, what about your thoughts about Kyle Rittenhouse, the young man that killed two protesters and injured one person? No? Okay, well, I guess I can move on to the Postal Service information. So I want to briefly talk about the USPS. I'm sure most of you do not know, I briefly worked for the United Postal Service as a postal carrier, among many of my other jobs, before making a hobby into a career, which is in IT. My brother, he currently works for the post office as well, and he's been there for over 20 years. It is true, they did stop overtime, which can cause a backlog of mail. If they require you to stop at a certain time and you haven't delivered all your mail, the mail has to come back to the docks, and it won't be delivered until the next business day. So therefore, you start attaining a backlog. That is one of the reasons why we're experiencing slow mail delivery. Gus claims medications sent through the mail would continue to be received in a timely manner. But according to several news sources, complaints are piling up about slowdowns. Even Connecting Vets and Dave, a nonprofit charity that provides lifetime support for veterans of all generations, have received reports of drug delays for veterans. Gus also claimed that there is no impending crisis and no threat to constituents' ability to vote by mail through absentee ballot. Well, that's partially true, but according to letters from the U.S. Postal Service to the State Elections Commission, there is a risk that ballots requested near the deadline will not be returned by mail in time to be counted. So last week, the House passed a bill which I support called the Delivering for American Act. The bill would prohibit postal services from making changes to operations and establishes requirements for processing election mail and providing additional funding to postal service. Of course, Gus called the bill a highly partisan measure and voted no, even though there were 26 of his Republican colleagues that voted in favor of the bill. Anybody has any questions about what's going on with the United States Postal Service? Wow, I've got a quiet audience today. And don't forget, you can enter your questions, in the question section. All right, so I guess I'll just move on to the CDC. So the CDC published Monday that people with no symptoms do not necessarily need a test, even if they were exposed to an infected person within 6 feet of the person for at least 15 minutes. But, that's really didn't make any sense. And of course, the medical community criticized the CDC for loosening the guidelines that some believe was made for a political reason rather than scientific. So on Thursday, the CDC changed the guidelines again, and now it states that for those who come in contact with a confirmed or probable COVID-19 patient can be tested even if they don't show symptoms. And so in my opinion, testing is important, and everyone should be allowed to get tested in order to stop the spread of the virus. Oh, come on, guys. I got to ask me some questions because I'm running out of stuff here. All right, so I guess we'll move on to the RNC. So I'm sure that, some of y'all have seen the RNC, what was happening on the RNC Convention. Okay, so in my opinion, the RNC Convention was a bunch of propaganda. According to the CNN, they counted more than 20 false, misleading claims from Trump on Thursday. All I heard was socialism, 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 all praise Trump, riots, looting, lawlessness, pro-criminal, anti-police, socialist policies, the radical left, and lies on the coronavirus. So let's start with Jack Brewer. He was the former NFL player, and I don't know where he got his information from. The media has never stated that Trump said there was very fine white supremacists. We all heard it. We all heard what Trump said. He basically stated that there are very fine people on both sides. So in my opinion, somebody needs to check his teleprompter. For Representative Jim Jordan of Ohio, he basically stated, in spite of the unbelievable opposition, referring to President Trump, he has done what he said he would do about building the wall. 4 years of President Trump has resulted in no big, 4 years of President Trump hasn't resulted in any big, beautiful wall being built, unless you want to count replacing the existing walls. And Ronna McDaniel, she's the chairman of the RNC. I know she's related to Mitt Romney. Anyway, in her speech, she stated that we, Democrats, want to completely take over the government of their healthcare system, so moms, pandering to suburban women, like me, won't be able to take our kids to the same pediatrician they've seen for years. Okay, most Democrats are in favor of universal health care, where the government reimburses the doctors. And take note that under the current system, insurance companies can drop pediatricians and other doctors, so I really don't know what she's talking about. So I'm going to briefly touch on some of the misinformation that came from Trump's mouth in his speech. First, he claimed he passed the Veterans' Choice. No, that was President Obama. He signed it into law in 2014. Trump also touted a record 9 million jobs gained over the past 3 months, without mentioning that a record 22 million jobs lost over the previous 2 months. He also boasted the COVID-19 testing system and his general response to pandemic, even though the majority of experts say that the U.S. was slow in its response and slow in setting up an adequate testing. Numbers don't lie. And did you hear that Trump again pledged that the entire Republican Party will always and very strongly protect patients with pre-existing conditions? Meanwhile, there's a lawsuit that Trump supports to declare all of the ACA void. If that happens, people with pre-existing conditions could lose their coverage. Trump continues to double down on his long-term pledge to lower prescription drugs, yet 857 brand and generic drugs have increased from January to June by an average of 6.8%, and 67 increased in July by 3.1%. So does anybody have any questions? Comments? Oh, nobody has nothing? Anything? All right, well, so I guess I can talk a bit about, my policies and what I'm trying to do. For those who have not, this is their first time, I'm Kimberly Walker, running for U.S. Congress. I served in the United States Army and the Air Force. I attended St. Petersburg College. I received a Bachelor's of Science degree in Technology Management and a Master's degree from Florida Institute of Technology. I decided to run because I didn't like the direction our country is going. My mother, she's a retiree and works part-time as a school crossing guard. Her diabetes medication costs over $500. My brother and I, we pay for mom's medication, but there are so many people who don't have that type of support system. Last year, I read an article from the Tampa Bay Times called called Florida's Refusal to Expand Medicaid. It cost 2,800 deaths. My cousin was one of them. She died at the age of 24. At the age of 49, because she couldn't afford health insurance. And as a member of the LGBT community, we are still fighting for equality in the 21st century. As an African American who has been racially profiled, we continue to fight against police brutality and fight for racial equality. These are just some of the reasons why I decided to run. I believe in a government that will work for all its citizens. I do not accept what has been presented as our only option, and want to give voice to constituents in District 12 and ensure all residents are guaranteed health care, better education for our children, and a clean and safe environment. So for health care, this pandemic has brought some clarity to me. Millions of Americans have lost their jobs. In turn, they've lost their health insurance. And with the recent decisions from the Supreme Court ruling, employers can now deny women free birth control based on religious rights. That's why, for me, I believe it is time to move to some form of universal health care. We cannot allow employers to decide what health provisions they deem they will or will not provide. And our economy, well, it needs help recovering from the coronavirus pandemic. We also need to quickly create millions of clean energy jobs in order to tackle the climate crisis. Combined, we have an opportunity to create good-paying jobs and put people to work building our clean energy future. This should be at the center of the economic stimulus, in my opinion. And I bet you wonder how. Well, catalyze massive investments to deploy clean energy tax incentives and establish a green infrastructure bank. Dramatically expand investments in government-led clean tech research and develop to reestablish the U.S. as a global climate innovator leader. Ensure jobs in new clean energy economy are family wage union jobs by supporting workers' rights and investing in apprenticeships, skills training. And probably next week I will be coming out with a plan on how to put people back to work safely, for one. Because I still believe that since this pandemic, there has automation is going to really jumpstart, is going to go into faster demand, where our emerging technology is going to take over some of the jobs that people previously had. I also have a plan for higher pay for our teachers. Education, of course, is the cornerstone of democracy, and providing quality education is one of government's most important obligations to the people. If our children are to receive a quality education, we must increase teachers' pay. I propose creating a permanent $1,300 refundable teachers' tax credit. The result would increase a take-home pay of $230 per week. As a member of the LGBTQ community, despite significant steps forward, we still lack basic legal protections in states across the country. I support the Equality Act that would provide non-discrimination protections and would amend the Civil Rights Act to include sexual orientation and gender identity and cover employment, housing, education, and federally funded programs. For women's rights, I believe that women should have the ability to make their own health care decisions. Those decisions are between a woman, her doctor, and not policies coming from elected officials. I also believe in equal pay for women. Salaries should not be based on salaries should be based on education and experience, and not on gender. For veterans, as stated before, I am a veteran. Technically, I'm a disabled veteran, even though it's less than 10%. I believe I can do more for vets than Gus Billirakis. Gus gets his ideas from other people, vets and veterans groups, which is fine, but Gus doesn't create ideas that are original. He's not innovative. He doesn't think outside of the box. He's not a veteran, and it doesn't seem like he has a good idea of what the veteran experience is like. For example, filing disability, I understand the process because I went through it. The VA needs to be more helpful for veterans. They continue to give you the runaround. And once you're in the system, there's always pushback. The list goes on. Also, I understand the struggle of returning to civilian life after service. I went through it myself. I was depressed. So I'm currently working on how to streamline filing for disability claims, and also even request service records, which can take up to a year to get your service records. So anybody have any questions about, um, you know, my policies, what I'm running on? No? Okay. Well, so I don't know if you heard a while back, Trump had his executive orders. Um, that he signed 4 executive orders that will have little impact for the millions of Americans that are struggling. Now, he wanted to do, he signed into law with $400 per week extension, but there was kind of a catch. So basically, he wants the states to commit to providing $100 and out of that $400. Now, the state of Florida has finally signed on to it. But I don't think that they're going to be paying that additional $100. So people who are unemployed are only going to receive the $300 per week. And that's $300 less a week than what the federal government was initially giving them. States are struggling. And plus the fact that I don't know how long it's going to take. I did hear that I guess they're going to backdate it to August. But they have to reprogram the computers in order to accommodate the new amount. For the payroll tax deferral, so your employer portion of Social Security will not be taxed, so you will see an increase in your paycheck. But please be advised please be advised to put that money aside, because currently it's only deferral. Meaning that next year taxes, Uncle Sam is going to want his money back. So unless Joe Biden decides to eliminate it, if he's president, and to be fair, Trump did claim that if he was reelected, that he was going to defer it too as well. But I'm not going to hold my breath on that one. For the student loan payment relief, eviction minimization basically is to identify, review, and action to minimize residents' evictions and foreclosures. The second part of the order is like the HEROES Act by paying landlords to avoid eviction for foreclosure. The difference is that the House has the money, and Trump will be taking federal funds from various agencies like FEMA. So the executive order for pre-existing conditions, according to Trump, as I spoke about a couple of minutes ago, that he has an executive order basically supporting that the Republicans will always cover pre-existing conditions. And okay, yeah, I don't really believe that because they're trying to get rid of the ACA, and after that it will be nothing. And so we will go back to the old system where where the insurance companies can deny you based off your basically what happens is, because I had this happen to me before the ACA. So I had a pre-existing condition, right? And I was trying to get some health insurance, and they put in a rider where it that pre-existing condition was not covered. They still covered me, but not the pre-existing condition that I had. So that's what probably would happen if the ACA if they deem the ACA as unconstitutional. Let's see. So anything else? Does anybody have any questions? I just can't believe there's nobody typing anything in here. Because if not, I'll probably have to end this early. Now it'll be just a half an hour, because that's about basically it. I've pretty much covered the shooting of Jacob Blank, the UPS, and the DNC, and then of course CDC, recent changing. All right, well, I guess I will be ending half an hour early. So once again, thank you for coming, and please feel free to reach out via Facebook or Twitter. I'm on Twitter as well, and Instagram. If you have any questions about the campaign, or you can also go to the website, KimberlyForCongress.com, and and I'll definitely try to respond to you and answer some of the questions. So everybody have a great night. Have a great weekend.